part of what makes Dementia Capable Care different definitely is putting on that different lens, that perspective of what can people still do instead of what they can't at every stage of dementia. Because it is never ever a true statement that this individual can't do anything anymore. That is never true. Very first class was in October of 1998. And we were probably all shaking in our boots. And we had our notes in front of us. We knew what we wanted to say, but we're a little nervous. But immediately, that very first group came up to us on the lunch break and said, I had never been thought to look at people with Alzheimer's in this positive frame of reference. And I think it was that connection with these participants of, now I see the light. Now I know I have a better way. And that is simply seeing what they can still do instead of what they can't. So I definitely think that is one of the keys to Dementia Capable Care, is unlocking that emotion, that perspective, and therefore it unlocks that potential that lies within persons with Alzheimer's at all stages. I think professionals, we all want to feel good about what we did at the end of the day. And when you work in healthcare with people with Alzheimer's, you're constantly being told the negatives. Like I said, the language that we use. Just think about that for a minute. We are encouraged to label people with Alzheimer's negatively. They're a wanderer, they're a rummager, they're confused, they're pleasantly confused. So many of the cognitive assessment tools are assessments in which we're checking off boxes of what they can't do anything anymore. So that's like a big dead-end negative street. So professionals who come to our programs immediately feel this empowerment and this impact of, wow, you just took all those negative things, threw them aside, and you're showing me what this person can still do. Now I know how I can help. What I want everybody to know, everybody in this country, is as we're facing an epidemic of Alzheimer's, there should be an army of support for these individuals. They deserve it. Their families deserve it. So I want people to know that that opportunity to receive those services is there. And I want every healthcare professional to stand up and raise their hand and say, I want to learn, because I want to be able to help care for these individuals and give them what they deserve, which is quality of life.